mortality rate. Something as small as an infant mortality rate, I think the numbers in some developing countries are even better than the United States. So this is an illusion that most of the people in the developing world have, is that the more you spend, your results are going to be augmented. That is not really true. But let me tell you why this illusion is. In United States, the cost of healthcare is not high. The cost of managing healthcare is high. And that is why it's $1 trillion+ industry in the United States. So if you spend $100 on caring a patient, essentially only $22 to $28 is truly touching the patient, whether it is the physician care or the nursing care, and the entire $80 out of it is spent in the management of healthcare. So the decimation of $100 is not entirely for the care of the patient. And that is why I believe that the economicity of healthcare in the developing world has a far more sensitive power than the United States.
Absolutely. And let me add to this that the model of United States is not necessarily an optimized healthcare model. You're talking about $3 trillion being spent, but again, is the patient getting the healthcare they deserve? It is controlled by TPAs, insurance companies, etc. So the first thing we need to understand is that we are a different country and we should not adopt the US model eyes closed. That is the first part. The second part to your question, that is the healthcare reaching where it is required. So let us talk a little step back. The spurious medicine, the pharma part we've covered, but let's talk a little about healthcare. You're talking about a $65 billion industry going to something like 100 billion by 2015 and something like 300 billion, which is 3 times by 2020, right? So it is a huge opportunity. And again, you talked about, sir, the 100 billion opportunity. The current medical tourism is 3 billion. But look at the irony. The 75% of the infrastructure exists in urban areas, 75% of the need is in the rural areas. So I think there's a huge dichotomy wherein healthcare is not reaching where it is required. We were looking at some statistics and numbers. We are saying we need 700,000 more doctors, 1,600,000 more nurses, and 1.75 million more beds. And for that, we need $200 billion of spend. So where is that capital going to come from? Is one huge concern, because it's still, if you look at the venture capital side, etc., it's still a very evolving climate where companies are not ready to invest in hospital projects which will take 10 years to kind of gestate, or R&D ventures for that matter, where it takes 1 billion to develop a drug in 15 years. So that's just a viewpoint that the demand-supply gap is huge. Demand is excellent, but supply has to be created.
You had some point here.
I just want to add that we are talking a lot on spurious. In my mind, more than the spurious, the issue we have is of compliance. I mean, Bombay does not represent India. We go to the UP and go to a village, and there's a guy who has a tuberculosis, where the medicine is required to buy for 6 months or so, till the government sponsored this program. The rickshaw puller who earns 40 rupees a day, he actually buys rifampicin or whatever the drug is required on the days that he makes money. So he buys one day, he doesn't buy another day. We talked about why strip cannot be bought. The guy wants to buy strip, the guy wants to comply, but he doesn't have money to do that. So until as the government comes in, and in the US, etc., where there's a lot of insurance, possibly all that is easy. So I think, to my mind, spurious, compliance, there are a lot of issues which we need to address at some point.
Very good point, sir. Well, I think for the concluding question or a comment, I would request our friends from Aam Aadmi Party, because this is a topic that is very close to the Aam Aadmi. You have heard the panelists talking eloquently about not the ivory tower medicine that people normally talk about in 5-star hotels, but the real Aam Aadmi who keeps cutting strips into 1 tablet and 1.5 tablets, literally. Can somebody from the Aam Aadmi Party share their thoughts or ask a question or something? Then we'll end this discussion with that.
Yeah, can I?
Please.
See, during the panel discussions, we addressed the 2 points like the drug adulteration and spurious drugs, which Handa also told us that they went almost up to the gate of the manufacturer, but nothing could be done. The reason is there is no fear of law in our country. The moment there is a fear of law, things can be set right. Now, if I say US and UK are law-abiding citizens, they are law-abiding. The reason behind is that the fear of the law. Here the law takes its own course, and they know that they can buy out the people. Now what I'm asking is, IPA with a lot of this financial strength, etc., can they put the pressure so that any case that is taken up is disposed of expeditiously so that the people will have more faith that people will be caught and put behind the bars? Thank you.
Thank you, sir. I am afraid we don't have time to go deeper into this, but it's a very good point you have raised. Perhaps the discussion can continue out there along with a cup of tea or something. So may I request Mr. Satya Brahma? Can we close the session now? I think we have exceeded the time.
So let's close the and we'll break for tea actually.
Okay. So thank you, everybody. It has been a wonderful experience sharing the days with you, and I hope you enjoyed it. Thank you very much. Sure. All outside. If you have finished your tea and coffee, kindly come in. Thank you.
Well, good evening, ladies and gentlemen. We're going to start about this medical debate. Many doctors are asking me questions why you are doing a debate on medical tourism, that too involving the top doctors of the country. But the point I wanted to make is that it is the doctors who perform, and it is they actually who make India as the ideal destination for the patients coming from abroad. This is going to be moderated by Dr. Srinivasan, who is a wellness consultant, has over 4 decades of rich experience in understanding the pharma market as well as the healthcare industry. He is a natural orator, facilitator, motivator, humanist, conducting wellness seminars and workshops focusing on work of the balances and other lifestyle issues for corporates as well as general audience in English, Hindi, Marathi and various other languages. Over 4 decades of standing in healthcare and human resources, he is an MBBS and MD from Pune University, the practice advisor for pharma, healthcare, life science, and consultant to Vito India. He is a founder trustee of Shastri Memorial Foundation, focusing on rural educational cum welfare projects. He is the former chief knowledge officer of the Wokhart Foundation. I had the pleasure of working with him when I was the CEO there. He is the former faculty member of the School of Medicine in US, former vice president of Aventis Mumbai, former editor of the Indian Practitioner, and author of a lot of books on value-based management in the Indian context, stress management, social business, 7 human values, and living in uncertainty. So Dr. Srinivasan is going to introduce the veteran team of experts who will be debating on the medical debate titled The Challenges and Opportunities of Medical Tourism in India. This will involve top consultant doctors in India as well as some of the owners of the hospitals as well. Over to you, Dr. Srinivasan. Thank you.
I think I will invite each panel member by name, and you kindly come on stage and take your seats. Number one, of course, we have the omniscient, omnipresent, omnipotent Dr. Hariawala. Sir, where are you? Where is he? Ah. Okay. All right. We have Dr. Kaushal Pandey, is a well-known cardiac surgeon attached to important hospitals in Mumbai. Welcome, sir. Please, please take your seat here. Thank you. Can I request Dr. Rashmi Shetty, cosmetic dermatologist? Dr. Rashmi Shetty? She's not yet here. Okay. Of course, the one and only Dr. Mukesh Batra, please. Grace the occasion once again. It's a pleasure. Thank you, sir. Would you like to sit here? Please. Ah, there you are. Please come. May I request Professor Nandu Laud, as we normally call him, he's Dr. Nandkishore Shamrao Laud, an extremely well-known and highly respected person. Welcome, sir. Yeah. Would you like to sit here? Thank you. Dr. Ravindranath of Global Hospitals Group, please. Welcome, sir. Please. Sit down. Dr. Harish Bhende, there, please. Dr. Harish Bhende. Is he there? Where is he? Oh, he's coming. Welcome, Dr. Bhende. Please take your seat there. Dr. Jayashree, Sharad. You'll get a chair here, not an issue. Dr. Jayashree, Sharad here? Okay. Well, ladies and gentlemen, I could, and I might or I should spend a little time introducing our distinguished panelists. But I'm not really sure whether we have that time, because if you go through the biodata of each and every panelist, I think we'll spend most of our time only in that, right? So according to Mr. Satya Brahma, my watch says it is 5 minutes to 6. What time should we wind up, sir? 6:30. So that does leave very little time for elaborate introduction. So if you don't mind, kindly don't feel offended. And these, let me say it again, I'm not saying it out of formality. They are very, very well known. And if I read their biodata, you will know, which probably you already know. Without much ado, may I request, maybe you, sir, if you don't mind, to set the ball rolling. Today we are looking at medical tourism. The very word, the very term or the terminology, or the semantics and syntax apart, the medical tourism evokes mixed responses. For example, some of our friends there who are socially aware and active will say, oh my God, India doesn't have to do medical tourism. We need medical healthcare right here. Why bother about tourism? At the same time, somebody like even our finance minister would say, why not have tourism? Let them pay and then we'll use that money to take care of our people, etc., etc. So I'm not a politician, but then it's up to you how you interpret it. Sir, can you enlighten us on this?
Thank you for calling me. I think when you talk among the fraternity, when they talk about tourism, they feel that doctors and hospitals wants to make money by having patients from outside. And that too what happens is today, we must say that last 10, 15 years, particularly after 1993 and after the economy opened, suddenly there was a surge of technology. And Indian hospitals had good technology, good doctors that time. And as compared to that, our Middle East part did not have excellent medical personnel. The NHS system had long waiting list. United States has more than 1.5 million Indians living there who were smart in the sense that in case they were to get something done, they would know that my mom is to be operated in the United States. It's going to cost me $30,000. While in India, my own friend, who is equally competent, as an excellent surgeon, is going to do it in 10,000. So medical tourism from the point of finance is one part. But exporting India's philosophy of medical tourism of 4 aspects: the preventive strategies, the other systems of medicine, the importance of health awareness, and 4th, in my opinion, the most important, is whether it is inclusive. We can't have only people who come to India and get it done, pay and go back. They must carry the message from here that this country has built-in system which will deliver goods the way they have promised. That's where I think we are here today. And we are in the urban areas, we have the hospitals. And we do not have that kind of infrastructure supporting the hospitals to offer excellent